wanted to go back to the origin of this project, Bridge Network. When we started introducing the proposal itself, I was together with Cynthia and Hirt and Marlene Temerman, and this is where we all started. That's why I said this is really one of the OHDSI Africa chapter achievement. Saying this, we have been evolving, and of course, OHDSI Belgium have been involved as well. That's why you see on this slide. Let me know if you see my screen, please.
Yes, I see your slides.
Yeah, good. So you see here at the bottom of this Belgium, I listed it because it was also involved. Several people have been involved. We have been sharing also the project details with them, and of course the OHDSI community is involved. And on the corner you see the African chapter. Talking about African chapter, I will not. I think Cynthia would do it very nicely, but I will just tell you that we are achieving a couple of things, and I will stick on only one point on this crowded slide, that African chapter is really raising awareness across countries in Africa. We have now a good attendances from all African countries, and we have even something which is specific to Africa. People are asking us to help the health system reporting. For instance, when you talk about PEPFAR data, they want us to contribute. Can OMOP CDM contribute to reporting on PEPFAR data, for instance? So those are some specific requests from African landscape. We don't see them elsewhere, but I think they will pop up. That's why you will not read everything, but what you have to know is that we have a couple of use cases in Africa. One of them is the projects which have been ended, like LICIDAR project, which was in Rwanda. You will have one slide about it. There is others which are running. I listed here. I am not exhaustive. I think Jim Todd, who is also online, will apologize because I will not list all the projects he's participating in, but I started by Drive project, which is in Rwanda, is running until this year, the end of this year. Then we have this big project, the Bridge Training Network, is a 5 years project, which will end in 2029. Then we have a lot of activity going on, like I listed here, Inspire Data Hub, which is a Pan-African integrated suite of services for harmonizing data. We have, I know people on this call can be better explaining it, but I will not go into much details for the sake of time. And we have Malawi, for instance, Open Health Data Lake, which is supported by Minister of Health there. We have much more in Ghana, Senegal, Kenya, Tanzania. So I will not go into too much all those initiatives. I will stick on only Bridge, but before Bridge, where are we coming from? Why we started the Bridge? Because there was a project in Rwanda, LICIDAR. It was the first one actually to harmonize data, hospital data, and to start what we call, federated, real federated network on hospital EHR data. It was really the first one in Africa. And what we did in Rwanda, it was directed to COVID. It was focusing to COVID data, but we took opportunity to harmonize the full EHR. So we have all indications there. What we did, we had 14 hospitals which were federated. And if you look at the data we have from them, they were, this is just a snapshot. Lars, if it's not visible, you will apologize because I picked from Iris OHDSI tool. You see how many hospitals we have where there are 14, where the dominating is measurement data, but we have some hospitals with really full data procedures, observation, visit. So this was really the starting point. And then when we saw this exercise in Rwanda, which was successful, that's the reason why Rwanda was ranked #1 in Africa to manage COVID, because we had, ETL normally is synchronizing sometimes every 6 months, every 3 months. In Rwanda, it was every midnight. So we were able to see the data daily, what changed from yesterday. And that's why Rwanda was really ranked the first one to fight COVID using data-driven insight. And when you look the next project again in Rwanda, now we moved from COVID to tuberculosis. This is a project which is funded by Johnson Johnson. Is running one is called Drive. We want to harmonize again more hospitals data. Here we have 10 health facilities in Rwanda, but the purpose is to extend it. And this one is really a next step to LICDAR project. And then we end up to move it to African countries. We have 7 African countries inside. We have 11 partners around the table, and it's funded by European Union through EDCTP3. It's called Bridge Network. The title itself, we want to scaling up research in sub-Saharan African countries, focusing on infectious disease. And it's really a consortium of both European people and African people. We wanted to train 10 PhDs people in Africa, based in Africa, and 4 postdoctoral people based in Africa. Why we talk about that, those are the countries. I will not come back to that. I will come back later on. We had a nice and a successful kickoff meeting in Nairobi. Those are the people who were around, not everyone, but who could fit on the picture. I wanted to stick on this slide. This is really the high level output 3. And the first one is really interesting for this community. We wanted to have a core infrastructure. What is a core infrastructure? In participating countries, we want to have a data hub. Those are harmonized data. We have 5 here. There are 5 countries on the bottom: Rwanda, Kenya, Uganda, Benin, Ethiopia, and South Africa. Each country we have a data hub. Those are harmonized data of hospitals or other registries like DHS, like in Kenya, or DHIS2, like cases of malaria, or other vertical programs. All those data will be in one data node. And on those, the people will be trained. Those are what we call ambassadors of OMOP-CDM. We want to have 10 PhDs ambassadors. That means, and this is my call to this community, if you have a project in Kenya and you want ambassador, someone who really is really versed into OMOP at the level of PhD, you look at those people. They will be mentored by people for postdoc, but at the same time with a huge community. And I think I have 2 slides to go. This is just illustration of how things will go. So we will train 10 PhDs, but the degree awarding universities are only 3, so they will be to register either in South Africa, either in Benin, either in Rwanda. And then European partner countries for mentorship, continuous mentorship. You see, we listed Belgium and Norway, but we have Eden people. We have OHDSI community. That's why I'm presenting it here. And you have OHDSI African chapter people. I have forgotten the credit for this design from Cynthia. Thanks for the nice design you forwarded it to me. at the beginning of the project. And if you look at the data we wanted to see, this is not complete. We are just starting. We started in last October, and here what we do, we are populating what is available in those countries, both for available data, the current situation, the domain of interest, and the targets we want to achieve. This slide will be shared with you after after the presentation. What is my request to this community? Three. How this community can really support these transformative initiatives. I will take only the case of Bridge Network Project. We have launched already the course for candidates for PhDs, but also for PhD, postdoc. Here we ask you to spread the information. If people, you know, people in Kenya, in South Africa, in Uganda, in Benin, please spread the information to have the candidates who are really at a high caliber. We are paying very well. This I have to tell you already. We are remunerating very well, both for PhDs and for postdoc. But we are also looking for people to be part of Project Scientific Advisory Board. The call will be shared very soon, but already we are accepting voluntary and anticipating people to express the interest to join us. We, at the same time, in the same level, we are also looking at you for the mentoring and the training teams. What they will do, what you will do. We will send you in one of the African countries to train people in OMOP CDM. I'm mostly interested, for instance, in the GIS data mapping and also in machine learning and data mining. This is a really key area. We miss people and we really need you. And then we want you to suggest the topics. I have seen interesting topics at the beginning of the meeting. If it would be interesting to have from you, just drop a topic to us and say, I would like to explore this in the African data. One of the PhD or postdoc will pick it. Also, if you have a data set to harmonize, you have a data set which is sleeping in one of the other countries, please feel free to submit. But also, this is a time really to network and to increase the collaboration. And I end up here. If you need to join African chapter biweekly meeting, there is a QR code, and you can. I will share the slide just now, and you can join us. We will keep updating. We are just starting, but I have also emails. You can send emails to me or to Pascal, who is the coordinator. Thank you very much.